Good morning, everyone. I think we roughly have probably everyone here now, so I think we're going to get started. Welcome to today's CAP webinar on coronavirus. My name's Rumney and I work in the comms team here at the ASA, and I look after all of our training and events. Today I'm joined by my colleague Janet, who works in our copy advice team, and Janet is our expert on advertising, all things to do with medicines, medical devices, and now obviously coronavirus related products. During this morning's session, Janet will be sharing CAP guidance on advertising medicines, medical devices, alternative therapies, and food supplements related to COVID-19. She will also have a look at the rules surrounding social responsibility to help you understand where the potential risks lie in marketing such products during this time. A big thank you to everybody who submitted their questions in advance. Janet will be covering all of this in today's session. So I'm going to hand over to Janet now.
Good morning, everybody. Hopefully this should start working now. Hang on. Here we go. Right, okay, so hi there, and thank you for joining us this morning. Today we're going to be focusing on those subjects the ASA has received complaints about, or the CAP copy advice team has been receiving queries about. And we're also going to be covering questions that some attendees have submitted in advance, so thank you for submitting those. Now, because a lot of what we're covering today is complex and nuanced, or relates to matters not directly covered by the advertising rules, such as the classification of face mask products, we can't cover everything in detail today, and in many instances we'll recommend that marketers wanting more information either come directly to the CAP copy advice team for some advice, or contact the relevant regulatory authorities for the product in question, and I will kind of cover that a little bit more later. We also have some written advice, a written document which covers the issues that are going to be covered in this webinar, and this was published yesterday, and you'll be able to find it by searching in the advice and resources section of the ASA website. And I think Ramneet is also going to be emailing this, or a link to this, at the end of this webinar. It's worth saying that we at the ASA and CAP are very much aware of the challenges this pandemic has created, and we're committed to showing regulatory forbearance, where this is necessary. In practice, this means applying a lightness of touch in some areas of our work, and then in other areas, kind of a much stricter stance on companies or individuals who seek to use advertising to exploit these circumstances for their own gain. For example, marketers running promotions should not use this health crisis as an excuse not to honour a stated price or not award a prize in a competition. There may be an element of lenience if, for example, the original prize could not be awarded due to travel restrictions or kind of other regulations that prohibit certain types of activity at the moment. But even in this scenario, kind of the ASA would still expect a reasonably equivalent alternative prize to be awarded. And it's definitely not okay to use the coronavirus as an excuse to abandon a promotion midway through and not award a prize. So quickly now, there's a list of the subjects that we're going to be running through today. So we're going to be starting by looking briefly at hand sanitizers, and then looking at face masks, and we'll illustrate that with a recent ASA ruling. Then we'll touch on medicines, foods, testing kits, and finally touch on the kind of broader issues of social responsibility. Now, we acknowledge some of the subjects that are being covered today might not be directly relevant to you right now, but we still hope that the information we're going to talk about is interesting and useful. So let's start with hand sanitizers. Guidance from the medicines regulator, the MHRA, indicates that hand sanitizing products fall into one of three regulatory groups, depending on the intended use, function, or composition of the product, or how they're described. Products primarily used to clean and moisturize skin whilst providing a secondary antimicrobial effect, such as liquid soap or solid soap bars, these are classed as cosmetics. The products whose primary function is to kill germs, disinfect or sanitize, or would use an active antimicrobial ingredient, such as hand sanitizers used in hospitals, and those obviously that are used by all of us at the moment when we can't wash our hands normally. these are classed as biocides and are regulated by the Health and Safety Executive. Products which make claims to treat or prevent infection associated with a specifically named pathogen are classed as medicines, and these are regulated by the MHRA, the medicines regulator. So, based on this, we understand that claims to prevent or kill coronavirus using products like hand sanitizer are likely to be considered medicinal, and marketers should not make these claims in relation to unlicensed products. So in other words, if it's not a licensed medicine, do not make references to the coronavirus. The MHRA have actually already got a lot of guidance on this, so it's worth looking this up. And also, if you can go to the HSE Health and Safety Executive website, there's lots of information on biocides there, so also look that up too. Okay, face masks. Before this pandemic, face masks were not a thing that most of us have considered unless we kind of work in healthcare or do some types of industrial or engineering work. And then all of a sudden, it's what everyone is talking about because we all have to wear them in some circumstances. Now, I should kind of mention that the focus of our advice here today is on ads that are aimed at consumers for domestic use, rather than those product ads which are aimed at health professionals in their roles. It's quite a complex and nuanced area, as you've probably gathered from lots of news about face masks. But marketers are strongly advised to ensure they understand all of the legal requirements of whatever product it is that they're planning to sell. It is ultimately up to a marketer to make sure that their products are legal and can legally be advertised. But in a nutshell, there are three types of face masks. So first of all, products which are designed to protect the wearer are regulated as personal protective equipment, more commonly known as PPE. Marketers of PPE need to ensure they meet the requirements of any regulation. So there are strict regulations in relation to PPE, and specifically in relation to PPE face masks and respirators. The Health and Safety Executive has a lot of written guidance on this, so we would recommend having a good look at this. Products like surgical masks, which are designed to protect a patient from a medical professional, are regulated as medical devices, so not PPE. And so again, if you're intending to sell this type of product to the public, you're going to need to ensure that the relevant medical device regulations are followed. And as with HSE having lots of guidance in relation to PPE, the MHRA, the medicines regulator, has got huge amounts of guidance on medical devices, and they've got specific guidance at the moment in relation to medical devices in relation to this particular pandemic. That will be in the kind of link to the guidance, the written guidance that I talked about earlier, lots of information on that. So everything else, so in other words, everything that isn't PPE or a medical device will be classed as general face coverings. So like I said, these are not PPE or medical devices, but they still would need to meet some basic safety standards under general product safety regulations. So as we currently understand it, if a product is not certified PPE, then claims in ads that a face mask or covering can protect the wearer are likely to be problematic. And this is especially the case because the government have been pretty clear that general face coverings have not been shown to have that benefit, as in they do not have the effect of protecting the wearer. So this was actually kind of explored in a recent ASA ruling. So this was the ad, and it included claims like protective face masks with further text stating protection against bacteria and viruses, also coughs and sneezes spread diseases, and so get peace of mind for yourself and those around you with a month's supply of these UK standard CE approved face masks. So although the marketer had told the ASA the products were not PPE, and they did not believe the ad suggested that they were, the ASA obviously had to consider whether the ad made protection claims and whether those protection claims were problematic. Now, as you can see, the ad makes multiple claims that imply the masks in question can protect the wearer, and the ASA were clear that this was the likely meaning to the consumer, which is obviously the most important thing we consider. That's the kind of meaning that they would take home when they're seeing the ad, especially during the time of a pandemic. So the investigation established that the marketer had not demonstrated that the products met EU regulations of PPE products, and the products were actually likely to be classed as general face coverings. So with that in mind, the ASA took into account the World Health Organization and Public Health England, as it was then, position on general face coverings, which was that these products do not offer protection to the wearer. So because the products were not certified PPE, and because of the clear position that face coverings do not protect the wearer, the ASA ruled that the protection claims in that particular ad were misleading. Looking quickly now on medicines. So I mentioned earlier that claims to treat or prevent disease are medicinal, and so they're only acceptable for products that are licensed for that particular purpose. So this essentially means that claims to prevent or treat coronavirus are likely to be a problem for any unlicensed products. Now, the medicines regulator have indicated to us that the main issues they have seen have been in relation to product claims about licensed products, but where the product in question hadn't been licensed to treat that particular condition, as in it hadn't been licensed to treat or prevent coronavirus. So it therefore seems there's not been much in the way of unlicensed medicines flooding the market, which is good news, of course. But this hasn't stopped some marketers making medicinal claims about unlicensed products, which, as we've already explained, is completely prohibited. So you're probably aware of alternative therapies, such as IV nutrition drips, where you go to a clinic and receive vitamins through an intravenous drip. They've become kind of very popular in recent years, and kind of clinics have been kind of really garnering the attention of quite a few influencers and celebrities. So the ASA recently considered ads that made claims about IV drips. So the claims in the ad included protecting you and your family from coronavirus infection. It also said, there is no vaccine available at present, so maintaining and boosting your immune system is vital, as this is your mechanism of protection against this virus and other pathogens. And finally, it said, boost your immune system and protect yourself from infection. Pretty strong claims there. And in that case, the ASA ruled that the claims in the ad amounted to medicinal claims that the vitamin drips could protect against the coronavirus. And because the products in question were not licensed medicines, the claims were therefore ruled to be problematic. This is also a reminder that it's not acceptable to advertise prescription-only medicines to the public. And the ASA also recently ruled against an ad which included the claims, in the fight against viruses, its vitamin B injection would boost immunity, and that it supports your immune system, lung function, and aids faster recovery from illnesses and viruses. Now, in that particular case, notwithstanding the fact it was advertising a prescription-only medicine to the public, which is not permitted, the ASA also established that the medicine in question had not been licensed to treat those particular conditions. So that includes viruses, but also kind of references to lung function and recovery from illnesses and viruses. So that particular ad and those particular claims were found to be problematic for multiple reasons. All right. Looking now at food and food supplements. Now, we could potentially do hours of webinar material that could apply to food products, because it really is quite a complex area, due in part to claims being restricted by EU regulations. So I'm not going to go into too much detail today, because I'm aware it's quite niche and kind of maybe not everyone listening sells food or drink products or sells supplements. But I'll give some kind of basic information and kind of talk about a ruling in a second. So basically, advertisers can only make health claims about a food or ingredient if the claim is authorised on an EU register of nutrition and health claims. So essentially, there is a list of approved claims, and you have to demonstrate that you can use that claim and that you've used that claim accurately. Advertisers also have to demonstrate the product meets the relevant conditions of use for a claim. So many of the claims on this EU register have a list of conditions about when you can use it and how you can use it. So these EU rules also prohibit completely some types of claim. So a claim that a food or a drink product or even a food supplement can prevent or treat human disease is just outright prohibited. You're not allowed to do it. So this is likely to mean that claims to prevent or treat coronavirus are not permitted, because that's a claim to treat or prevent human disease. And that's even in the context of authorised claims on this EU register I talked about, which relate to supporting the immune system. So I'm going to talk about that a little bit more in a second. So we know there is an authorised claim relating to immune function in relation to vitamins B12, vitamin C, selenium and iron. the wording of the authorised claim is really important here. So the wording of the authorised claim in relation to those substances is that it contributes to the normal function of the immune system. So it's really important to be careful when using this authorised claim in advertising, because the full meaning of the authorised claim must be communicated to consumers. Marketers should not exaggerate the benefit of the substance by cutting out or replacing words that would change the meaning. It really is quite strict in relation to how these EU regulations are applied. Claims relating to immune function, marketers should avoid wording that suggests the product or its ingredients could improve the functioning of the immune system, or which overemphasizes the role that certain nutrients play in the normal functioning of the immune system. And this again comes back to the specific wording of that authorized claim. So in kind of summary of that, don't refer to boosting, strengthening, stimulating or optimizing immune function, because they're likely to be seen as an exaggeration of this authorized claim we talked about. Don't make claims such as vitamin C is important for immune function, because this could be seen to exaggerate the role that a particular nutrient plays in the immune system. Do use the authorized claim, the elements of it. Important ones particularly are contributes to and either helps or supports from the authorized claims, and do use the term normal in relation to the benefit to the immune system. And this is to ensure there's no suggestion that the benefit gained isn't an increased functioning, but beyond what is completely normal. And also take care with the word immunity, because using this instead of referencing the immune system from the authorized claim could potentially be understood to mean that consuming a product will provide immunity to disease. Now that would obviously be a problem at any time, but immunity claims are particularly loaded with meaning right now and would be very likely to be a problem in ads for food or food supplements. So we're going to have a look at a quick case study. This is obviously all of these rulings we're talking about today have happened pretty recently. They've all happened in the last couple of weeks and months. But as you can see here, we've got an ad for a food supplement, which made claims including vitamin C has been proven to boost immunity by many global studies. It has now been tested in the USA and China as a possible cure for COVID-19. I've got another ad which included the hashtags immunity boost, vitamin C, and stay safe alongside the claim. After developing symptoms of a sore throat and headache, I got paranoid. I ordered this concentration of Vit C and took one stick. In about half an hour, I felt instantly revived and my headache disappeared and my sore throat was greatly reduced. Now, given what we've already talked about, you could probably guess how the ASA ruled here, but I'll briefly take you through it anyway. So this particular complaint about these ads were upheld in 3 points. So point 1, the ads were found problematic because they made prohibited disease treatment or prevention claims. So obviously that's in relation to COVID, but also in relation to the symptoms of COVID. So they were completely prohibited claims in relation to a food. 2, the advertiser was unable to demonstrate that the product contained enough of any ingredient to make any authorised claim from the EU regulations. And point 3, the claims to boost immunity exaggerated the meaning of the authorised claim on the EU register. And I kind of talked earlier about the risks of exaggerating in any way that authorised claim from the EU register. So obviously there's kind of quite a lot of learning here for cases regarding food products. But if you do want to know more about the basics of these regulations, then pop over to the ASA website and use the Advice Online article function to search for information on food and health claims. There's multiple articles about it. The CAP copy advice team that I work for can also give advice, bespoke advice on non-broadcast ads if there's a particular execution that you want advice on. Right, leaving foods and moving on to home testing kits. Now, I kind of appreciate that most people listening today are probably not in the market of selling medical testing kits, but we thought we'd include this anyway because it's really quite interesting. So we understand that testing kits, either for coronavirus or antibody testing kits, are medical devices and would need to go through a specific type of certification and approval, and that will be a different certification from the medical devices face masks that I talked about earlier. So if anyone listening is in the process of developing testing kits, they should look up in vitro diagnostic devices. And the MHRA have got lots of information on this, which explains the authorization regime that applies to these testing kits in more detail. And again, obviously, this is such a kind of unique situation we're in at the moment that there is specialist advice from the MHRA in relation to specific testing kits for coronavirus and for antibodies. Some more information. Whilst swabs are sometimes carried out in the home and sent off for laboratory testing, and I think this is kind of primarily for people who kind of can't go to a test centre, the MHRA has made clear that there are currently no coronavirus testing kits in the UK which are suitable for use at home in their entirety, as in that gives you a result at home, and it's actually currently illegal to supply products in the UK for this purpose. At the time of writing, the ASA and CAB also understand that whilst a positive antibody test can demonstrate the existence of previous infection if that infection had triggered an immune response, which actually isn't always the case, there isn't as yet evidence to demonstrate that any immunity against future infection has been acquired, or if it has been achieved, will last. So because of that, claims for antibody tests which state or imply that the test can give any indication of immunity or can provide peace of mind or kind of that type of claim are likely to be considered by the ASA and CAP to be both misleading and irresponsible, because obviously it could affect behaviour. It's also worth noting that marketers of authorised testing kits should not make misleading claims about the accuracy of the results of those testing kits. So finally, we're going to move on to issues of fear and distress and social responsibility. We all have to acknowledge that living through a pandemic is a frightening experience for a large number of people, and that references in ads about the risks of the virus and its health and economic consequences could cause anxiety in consumers, and kind of understandably so. Having said this, the ASA and CAP are also likely to consider that kind of careful and measured references to those risks are not likely to cause unjustifiable fear or distress, and that's the test here, is whether it's unjustifiable or disproportionate. We are, after all, living with this virus. It forms part of our everyday lives and our decision making. It would seem ridiculous not to be able to reference what's happening to everybody right now. When developing ads that reference the coronavirus, care would need to be taken not to exaggerate risks or to focus on those risks in such a way that consumers are likely to be made disproportionately fearful or distressed. For example, an ad for a health clinic which encourages consumers to improve their overall health is likely to be acceptable. But a claim that suggests certain individuals run the risk of dying if they don't do something about their health could be considered to cause unjustifiable fear or distress, and also could potentially be considered to be misleading. Care would need to be taken to avoid taking advantage of consumers' economic fears. That's very much something that's happening at the moment, just as much as our health fears. So the ASA and CAP are likely to take a really dim view of marketers using the crisis to market some types of product to those who could be considered vulnerable. For example, particular care would need to be taken in promoting high interest short-term loans or even kind of high risk financial investments to those who may be suffering financially, or just as importantly, fearful of future financial difficulties. While the public are generally likely to be aware of government advice on social distancing, frequent hand washing, and the requirement to wear face coverings in some circumstances, marketers really need to take care not to do anything to undermine important health messages. So you should therefore take care to avoid presentations that could be seen to actively discourage consumers or encourage them, to disregard the rule or spirit of government safety recommendations. Like an obvious problem, for example, would be an ad which suggested that consumers should not wear masks in supermarkets. A more subtle example of what might be problematic could include a presentation of a group of friends who are not socially distancing, but in an ad which is very clearly set during the pandemic. Ads which make no reference to the current times and which happen to include incidental images of friends close by each other are not likely to be found problematic. So I'm going to quickly summarise what I've talked about. Firstly, make sure products are appropriately certified and can legally be sold. Avoid COVID-19 prevention or treatment claims unless they are permitted or licensed for that product or purpose. and do not cause unjustifiable fear or distress or seek to take advantage of financial economic concerns. So there we have it from the main content of this presentation, and I'll pass on to Ramneet now for some more information. But in the meantime, please look after yourselves, stay safe, and of course, wash your hands.
Thank you so much, Janet. I hope everybody found all of that information and guidance useful, and hopefully you'll be able to use some of it and put it into practice in your day-to-day work. So just before we finish for today, I wanted to give you a little bit more information about some of the other training opportunities that we have available here at the ASA. We've got a really extensive e-learning platform. So if you have heard anything today and thought, actually, I'd quite like to do a little bit more training or find out a little bit more about a particular topic, whether it be misleading advertising, promotional marketing, you can go and have a look on our e-learning website and have a look through the different modules that we have. They're a really, really great opportunity for anybody who's looking to train remotely and within their own time as well. We also are on Twitter, so please do follow us if you're also on Twitter. We regularly post about our rulings on there. We also have our Insight newsletters as well, which we share any new CAP guidance and advice articles. And we also run bespoke training seminars and presentations. So if there's anything you've heard today and you thought, actually, my colleagues or my team may really benefit from finding out a little bit more information about a particular topic, or you'd like us to put together a training that is specific for the work that you do, then please do get in touch and we'll be able to organise something for you. As Janet mentioned, I will be sending an email after this session has finished with all the information about where to go if you've got any more questions about any of the content that's come up today. You can direct those to our copy advice team, and I'll also pop a link in there as well to the advice article that Janet wrote regarding coronavirus and advertising coronavirus related products. But apart from that, I hope everyone found today's session useful, and Janet, huge thank you. It was really, really fantastic session. So thanks everyone, take care, bye.